Hi, my name is Dr. Stuart Maslin, and I'm one of the doctors here at Cannabis Card Orlando. I'd like to welcome you to our office, and I'd like to give you some information about the dosing and administration of medical marijuana products. The marijuana plant contains around 420 chemicals, about 108 of which are cannabinoids. Cannabinoids are chemicals like CBD and THC that have an effect on your body system called the endocannabinoid system. The endocannabinoid system is a regulatory system in the body which helps to control the nerve transmissions that occur in your brain and peripheral nervous system. The nerve transmissions sometimes will go awry when you have a pathological condition such as anxiety or chronic pain or a pinched nerve or many other conditions. And therefore the cannabinoid products that we can give you for those problems will be helpful in controlling those symptoms for you. When I think about the marijuana plant, it reminds me a little bit about a movie production company, in that the marijuana plant has the actors, which are the CBD and THC and all the other 106 cannabinoids that are known to us right now, but it also has a director, the director that tells the THC and CBD and other cannabinoids where to go, what to do, and when to do it. That director is called the terpenes. The terpenes are a whole other class of chemical in the marijuana plant. There's about 15 or so, and those terpenes are very important in determining how the THC and CBD will affect you. Different terpenes will have different effects, and therefore different flowers will have different effects on you as well. The Entourage Effect is the effect that we get when we combine all of the chemicals in the marijuana plant together, and you get a synergy occurring between those chemicals where they can help each other and potentiate each other's effectiveness, so that the net result of putting all the chemicals together is actually greater than the sum of the individual parts. That makes for a very interesting experience for those of you who have tried different types of flower and know that different flowers will have different effects. Many of you probably know the indica is very good for bedtime use. So how we remember that is indica puts you in the couch, and that can really be helpful when you're trying to sleep at night and you're a little bit too wound up from the day. The sativa is very activating, and the hybrid is somewhere in between. A lot of you may find it helpful to use a hybrid as opposed to a sativa if the activation of the sativa is a little bit too intense. When we work with medical marijuana, we work with primarily two primary components of the marijuana plant, that being the CBD or cannabidiol and the THC or tetrahydrocannabinol. Both of these components are very different from one another, despite the fact that they are both found in the same plant. Interestingly, the CBD by itself tends to be a bit on the sedating side, but the THC, on the other hand, is quite activating. What's very interesting, though, is when you put the two components together, they act sort of like opposite forces, the yin and the yang, like in Chinese philosophy, whereby the CBD tends to help the THC become a little bit more mellow, and the THC helps the CBD become a little bit more relaxing. When you put the two together, you achieve a nice balanced effect with the two of those products. What I'd like to discuss with you today is how we get those products into your system to be effective in controlling the symptoms that you want them to control. There are several methods actually for administering these products, one of which is an inhalation such as a vaping pen. It doesn't have to be a vaping pen because actually there are now inhalers on the market that contain CBD and THC. There's also an orally administered form, of which I like a product known as concentrate. Concentrate is the concentrated form of the CBD and THC, whereby you get approximately 900 milligrams of combined CBD and THC in 1 cc of this very dense and viscous liquid. Approximately 3 milligrams of the product will be found in a small speck the size of a grain of rice. On the other hand, with the inhalation, you get approximately 3 milligrams as well with a 3-second inhalation from most vaping pens. The inhalation route is very effective at getting fast onset of activity and relief of your symptoms. This will work in approximately 60 to 90 seconds. However, the downside to it is that it only lasts for about an hour. So you don't have to keep vaping all day long. I like to combine it with the concentrate, which has an advantage of a very long duration of activity. In fact, if done properly, you can get between 6 to 8 hours of activity from that one little rice grain of that concentrate. However, the downside to this is it is delayed in onset. So what we do is we put the two of them together. By using the vaping and the concentrate together, you get the best of both worlds. The vaping acts very quickly, but only lasts about an hour. However, after the vaping starts to tail off, the concentrate is starting its activity and will last between 6 to 8 hours in duration. I would recommend when you start that you begin with a 1-to-1 ratio, because what I'm going to do is give you instructions which are written down during our visit that will allow you to refer back to the technique that we use to dose and administer these products. Then you can take it from there, adjusting your dosage on a once-a-week basis and allowing that dosage to equilibrate in your system over that week. After it reaches a steady state, you'll be able to tell quite nicely if that is the right dosage for you. And if it isn't, not a problem. We can adjust the dosage up very easily just by increasing by 1 rice grain or increasing by 1 inhalation. So it should be no problem for you to reach that level of medication that you're looking for to relieve the symptoms that you're experiencing.